Hi, I'm Dr. Howard Lux, here to talk to you about your recovery from meniscus tear surgery or a knee arthroscopy. A meniscus tear is a tear of the cartilage disc or cushioning within the knee. It is likely that you've now suffered from pain for quite a while, and an MRI has revealed a tear, and you're considering or just recently underwent surgery to repair or to remove the torn portion of the meniscus. So your recovery is going to be influenced by the type of tear that you had and the type of surgery you had. For those of you who underwent a meniscectomy or a removal of the torn piece, generally your recovery is much more rapid because we allow you to return to your usual activities sooner. As long as you did not have a significant amount of arthritis, most of us allow you to move immediately. We encourage you to walk around often, and we encourage you to work on your strength and your range of motion. Now, if you did have some osteoarthritis, also noted at the time of surgery, that's going to complicate things because we cannot address osteoarthritis with an arthroscopy. We can remove some of the inflammatory tissue and smooth out loose pieces of cartilage, but we cannot give you back the cartilage that you have lost because of arthritis. So, if your surgeon let you know that you had moderate or severe arthritis, then your knee is going to be cranky and it might not respond well, or certainly will not respond quickly. If you did not have any significant arthritis, then you will respond much more rapidly and find that you will tolerate activities after surgery much sooner than those with arthritis. Now, let's talk about those who had a meniscus repair. So we've stitched the pieces of your meniscus tear back together again. We need to let that heal. If it doesn't heal, you will tear the sutures and the tear will come back once again. Most meniscus repairs have a success rate around 75 or 80%. In order to keep it as high as possible, you want to listen to the precautions or restrictions that were discussed with you by your surgeon. Some of us will limit the amount that you can bend, and initially we might keep you in a knee brace or ask you to use crutches. No matter how good your knee feels, you want to listen to your physician. Now, preparation. Before your surgery, if you're lucky enough to see this video then, you may wish to invest in a compression sleeve or an ice compression sleeve, which may help control some of the swelling and certainly make the knee feel a bit more stable and a bit more comfortable in the early postoperative period and during your recovery process. Do not get a sleeve that's too tight. That's not how these sleeves work. If it's too tight, it's going to be too uncomfortable and you're not going to wear it. So, your recovery will depend on the type of meniscus tear you had, the type of surgery that you had, and it will also depend a lot on you as a person. Some of us have less pain than others despite having the same surgery. Some of us are much heavier than others. Those who are heavier need to progress more slowly because you do have a risk of developing stress fractures or stress reactions. Even though the risk of blood clots is fairly low, we encourage you to move your calf and squeeze your thigh muscle and walk around, if you're allowed to, as much as possible to keep those risks to a minimum. So, I hope you're recovering well from your surgery, or if it's off in the future, cheers. Good luck to you.